Hey everyone, this is Dr. David at El Paso Manual Physical Therapy. I've got my pal here, Oscar, one of my personal trainer friends here. And so anyways, what I wanted to discuss with you guys today is if you end up needing hands-on neck treatment because you've got some neck problem, I'm going to just do some quick tests and some treatment so you can see what it looks like. And just to be clear, we've already checked out a few things with Oscar. We make sure that he's safe for this. We don't do this on just anybody willy-nilly. We make sure we check out and make sure it's appropriate. And one of those things that we need to check is if he's had this done in the past and if he's had any bad responses. It's actually his first time. He's never had these techniques that we're going to go through today. We've checked out some stuff, so he is a good candidate for this, and we know it's going to be safe. But all that aside, I'm going to go into some hands-on stuff next just to show you how we would check it and how it's pretty gentle. So just relax here, Oscar. Just be on the table like this, just face up, and then I have my hands lightly on his neck and just going to check each individual joint. So that's C2, C3 on the right, going down to 4, 5, 5, 6, all the individual vertebrae here. And then we check the other side, of course. And what I'm looking for in this case, if he were to be somebody that had neck pain in a certain area, is for a joint that isn't moving good or some muscles around those joints that also need to get some better movement. And so actually he's a little restricted up here in the top right. Do you feel tender? Mm-hmm. Right there? So compared left to right, which one's more tender here?
The right.
Okay. And so then I can just, I check things a little further just to be real thorough here. Is that tight? Mm-hmm. Okay, now going to the right side. Is that more or less tight than before?
Less.
The other one, okay. Just check another segment here. And just let me move you. Let me know if I'm hurting you, I'll back off. Okay. So there's some areas here I want to work on. So what I'm going to do first is just do a little bit of massage. We call it soft tissue work, just loosening up the muscles. And usually people love this. It feels really nice. The upper trap, this muscle that runs from the neck to the shoulder, commonly gets a lot of knots, a lot of tension put through it. It's a muscle that people say that they carry their stress on. And so we like to loosen that up first if it's indicated, if you need it. What Oscar doesn't have here that I would not be doing this on if that were the case is some very flared up nerves. We treat that very differently, but this is more just muscular and joints related, so we can get in there and dig. If it's mainly nerve related, we approach things a little bit differently. So then we get into some of the muscles in the front of the neck here. And that's a little tight there. Oh, that one's even more tight. Is that tender at all? Mm-hmm. Okay, now let's compare that to the other side. Is that tender at all there? Mm-hmm. It feels different. It feels like I can push through a lot easier, more resistance on this side. So that's consistent with what I'm finding up top with these joints being stuck because they can produce tightness down here. So do you mind if I loosen things up for you here? Is that cool?
Yeah.
All right, so I'm just going to do a few easy techniques here. All you got to do is relax here, Oscar. Just let me know if I'm hurting you at all. Back off. Yeah, and it already popped just doing that. There we go. Just checking here. I'm not going to do a technique. So right after I do the technique, I make sure that we had improvement, that it was what needed to happen. So I'm rechecking the test that I did before. Great. So I'm gonna do one more because there's a joint right up top here that I want to loosen up. There's no twisting on this one, Oscar, just a pull. And I would usually be spending a little more time doing all these techniques, but just so that we're not on this video forever, I'm going a little quicker than I normally would. So I'm just going to check the tightness here real quick that I checked earlier. Is that as tight as before?
A little less.
Awesome. And it feels like pretty identical motion now. So that's what we do for certain neck conditions. Again, we take it case by case. We have to check out a bunch of things, get a history. But this is some of the techniques that we do here that is considered manual therapy, since we are El Paso Manual Physical Therapy. So if you have any questions or comments, please direct message us or comment on the bottom right here. We invite you to share this video, like it. Please, if there's somebody that you know that could probably use something like this, tag them on here. We love to help anybody out, at least with questions getting answered. Thanks, guys. Have a wonderful day. Thanks, Oscar.